Hi, my name is Dr. Nate Okpych, and this is another 4 in 4 video. So in this case, we're going to be taking a look at my 2015 article called Receipt of Independent Living Services Among Older Youth in Foster Care, Analysis of National Data from the U.S. So this study was published around the time that United Services data first became available. This captured information on whether or not older youth in foster care received independent living services that were funded by 1999 law. Sometimes it's called the Chafee law. And so since this was really a first pass using United data, main purpose of the study was to estimate at a national level rates of different types of IL services that were funded by Chafee. Second was to examine disparities in service receipt across a variety of different youth characteristics and by regional variation. And third, since this is one of the first studies to examine United data, I wanted to provide some cautions, some limitations of working with the United data to other researchers. So the sample included about 131,000 youths who were in U.S. foster care for at least 3 months between the ages of 16 and 21, sometime during the fiscal years of 2011 and 2012. Data sources I drew on AFCAR's and United data, the services file. Main outcome for this study was whether or not youth received any Chafee-funded IL service, and then how many of the 13 different types of IL services did the youth receive. You can take a look at the article for more information on the 13 types. I also examined disparities by gender, by race and ethnicity, disability status, and physical and mental conditions, and also geographic regions. And I used a variety of statistical tests to identify statistically significant differences at the 0.01 level. So some of the main findings, just about half of the youth received any IL service. And the average number of services youth received is about 2.3 different types of services. Most common received types of services were around secondary education, career preparation, housing and home management, and health education and risk prevention. In terms of disparities, we saw that females were more likely almost across the board than males to receive IL services, and youth with disabilities and conditions were also more likely than their peers to receive IL services. In terms of differences by race and ethnicity, multiracial youth and Hispanic youth had the highest service receipt rates. Black youth had the lowest IL service receipt rates. And among the youth who received any services, Black youth received the fewest kinds of different types of IL services. And this was especially true in large metropolitan areas. Youth in large metropolitan areas generally, they were less likely to receive IL services, and they received fewer types of IL services than youth in less densely populated areas. So in terms of implications, this is a first look at national estimates of independent living service receipt. We see that about half of the youth receive services. We found differences by gender, race, and disability status. One implication is if to narrow racial disparities in Chafee service receipt, good target would be to direct efforts towards Black youth in large metropolitan areas. About 70% of Black youth reside in large metropolitan areas. This is where a lot of the disparity exists. Also, services such as financial training and others, these are particularly important for youth who are living in large metropolitan areas. This is 52% of the sample. With housing and daily living costs could be especially high. However, these youth were least likely to receive IL services. The study also drew attention to several limitations of United. Check that out if you're a researcher, you're interested in using United Services data. And if you are interested in getting a one-page summary of this article, or if you want to request a free copy of the full article, please visit my website at nateokpych.com. You'll also find other 4 in 4 videos there.